everyone. Thank you so much for joining. This is the orientation program. We have restricted the participations and it's a marked beginning of the exciting journey. I am really honored and embark this journey is very important. So orientation program, basically it serves to it's a stepping stone, it's bridge which connects between you and me and the values and the mission of the course. And it's greater that we want to tell each this new chapter. You all who are joining this program should have take it as a new significant milestone, because it will change, you'll open your new experiences and it will help you in many more. Orientation program, we will get it with the vaginal surgery course. That's more important, because why we take a courses, why we want to join a courses, and what's important for us. So number one point is, it's a small group. We'll have the question answer session. It will be the interesting quiz sessions at the last, which we will do it, and we will get a participation certificate after the 8th module. So these three things are after the 8th module will be there. Then how we can improve, it will improve the understanding of the vaginal surgery across all the gynecological conditions. See, the vaginal surgery, each and every one can do. It's not a difficult task. With true speculum and valcellum, we can do many more things, and we can do many more. We can learn many more things. Then it also expands the career horizons into the professional network. See, I'm not discouraging you to do all the laparoscopic surgery or everything, but at least each and everyone should learn the vaginal surgeries. So horizons into the professional network is also important. Then these are the modules. There are video sections also. There will be lectures also. And there are eminent speakers also in the next 8 sessions, and mentoring sessions between the modules. So if any query, anything like that, you'd make it a habit to write this points into the chat box. So the Dr. Richa and Dr. Jyoti Karande are there. They will there to sort it out when we'll have this thing. The next thing is, what can you expect to learn from this course? That's very, very important. It's basically the foundation. We will start off the learning the basics of anatomy, what are the principles of the surgery, how to hold the needle holder, how to hold the scissors, how to cut a simple suture, and what to do. Very, very simple things are there which we can learn. Then its a mission is to learn about the preoperative assessment. What are the relevant investigations? Is there any score? Is there any guidelines? Is there anything like that which we can make them understand and all? Sorry, not able to admit people. So these are the another important point is. Then third is, burn it, tie it, but first know it. Get up to date the different type of suture. Either you can use a vessel sealer, or you can use anything like that, or any ligatures, diathermy, along with their surgeon relevance and the rest. Then we can come out 1 hour, learn the ins and outs of the non-descent vaginal hysterectomy. What are the points, how we can do it? These are a point. And then keep an eye on your neighbor, so that when we understand all these things, what are the classifications, what are the indication of the stepwise approach, what is the vaginal surgery versus the common contraindications are there, how we will deal with the adnexal masses are there, and we can become a proficient in the anatomy, lesions, and surgical approach of we can come to know about the Bartholin gland, the vulva, the cervix, which we should also know about all those things. And in a surprise of the art of vaginalism, we can familiarize with the sacrospinous slings operations, ectopic, tube tying, and more we can do with vaginal surgery. And then it's another important, we can learn fistula surgery, including the causes, diagnosis, treatment, complications, and follow-up, but it will be by the 8th module video. So we'll have the 8 modules. Number 1 module is for the establishing the foundation. And then we'll know the anatomy, what is the unknown and unknown terrain, what are the principles, what are the commandments of the pelvic surgery, then the instruments to play the music and the note. So various faculties will be there. They can teach you, they can talk you, they will talk about it. Second is, we should know what is the pre-anesthetic checkups, everything is there. What are the investigations, how the counselings, what are the expectation to make them come. And then, sorry, I'm not able to admit. Then in a case of, that will be a module 2, module 3, then vaginal hysterectomy in a case of fibroid uterus, then vaginal hysterectomy in a case of adnexal masses, suture, ligatures, and energy devices. This is another important point to do. Then module 4, will come with a volume of uterus, how to reduce the volume of the uterus, why volume of the uterus is important before doing the surgeries, what are the non-descent vaginal hysterectomy meaning, benefits, risks, and recovery. Then in a fifth module also we can do the keep an eye by doing the vaginal hysterectomy. How will you do with a big uterus? Then hysterectomy with a previous cesarean section. Then volume reduction in a vaginal hysterectomy diseases, all are there. Then high uterosacral suspension, that's another important in the 6 things. You can learn about it. Sacrospinous ligament fixation and lesions of the cervix and vagina is also, vulva is also important. We should know about. Then along with that, what new you can learn through the vaginal route, you can learn that ectopic pregnancies can be done, tube tying can be done, myomectomy can be done. There are several things which we can learn from this. Then colpoperineography, another thing. Sling suspension, we'll put another few things. Then addressing the leakage and swimmage, what are the etiology, diagnosis, treatment, post-operative care are also important. We have several expert faculties, right from Dr. Gurram Rathi, Richa Patel, Shrikala Prasad, Umarani, Anil Sakre, Ashish Kumble, Hara Patnaik, Jaiprakash Patil, and Jyoti Karante. We have so many good faculties with us. The arena and the practice can be focused with DGO, DNB, OBG, MD, OBG degrees, those can join. The specialty field they can choose and expand into. Why online course? Now that we have to reinvent, we have to reintroduce, and we have to revolutionize the vaginal surgery. That's my agenda, and will do best into it. Now we're mastering the art, rejuvenating the spirit. The surgery through vaginal route is an art and mastered by restricted to the gynecologist only. So we have seen many times that many other surgeries like laparoscopic or the surgeons also come into but vaginal route is restricted to us only. It's a natural passage of surgery, and the aim of this course is improve the skill and expertise the gynecologist to perform the various surgeries through vaginal route. And mastering the art and rejuvenating the spirit, the main attraction of the course would be the live surgeries we will show you, performed by the most skilled surgeons, mentors, and who have developed their approach. They have their own styles and the novel techniques in the field. We have the minute techniques, surgical steps, what are the new devices, how to hold things, methods of dissection, how to manage the complications can be observed and learned through these demonstrations, we can tell you. Then the journey of vaginal surgery in our 8th module, we will one day probably will fix it, show you the videos every time, all the day. Plus also the old recording of the vaginal live surgeries over there are also that we will also demonstrate. So the journey of vaginal surgeon, every renowned and established surgeon has a long journey and hard work, training and courage and perseverance is needed. And scientific innovations, inspiration, surgical practice will be enriched. And safety and popularization are archived, long-standing life work of the several gynecologists. So surgeries drive our vision to make each and every gynecologist to become a skillful surgeon with the best of the surgical skill. That's more important. And what the expert at her side, the excellence is not a skill, it's an attitude. So the future belongs to who learn skills and combine them in a creative way. The same, this innovative, the orientation program, I'm just putting the way it is like those who are not able to do the online vaginal surgery course, sometimes they can come on the spot also, on site also, to learn vaginal surgery from me. We have a team of people and we can teach you in many more. That is also there. And nobody ever mastered the skill except through the intensive, persistent and intelligent approach. Then the shaping life, the supporting, why we do it, why we want to do all those things is very, very important, because we're supporting the patients with the credible information. There's a program, is the patient doctor-centric program, is informed choices. And the learning curve and a gradual popularity is a key challenge in learning the techniques, which help the doctors to practice and popularize and prescribe with the understanding and importance of the procedures. And this present scenario of the glamorous laparoscopic surgery, I'm talking blah, blah, blah on the vaginal surgery, it needs to be more glamorous inspiration, and it should come from the performing concomitant surgeries. So what I'm saying, if you are planning to do or learning the laparoscopic surgery, definitely learn it. But this is the basic vaginal surgeries which we can learn. And this shaping life, shaping confidence by doing the uterus removal from the vaginal route, it gives a immense of pleasure when we do the vaginal route, and this gives the It's a very, very important thing. So who want to the progressive and benefits the best, because it is the best for the patient. And opening abdomen will not the abnormal even needed. And the end of the course will be able to accurately evaluate surgical skill, because it's not on-site. There is a difference of the on-site training courses and online vaginal surgery courses. But at least who has done the online vaginal surgery courses will able to enjoy the on-site courses in future if they want to get in that. Then what important point is connecting and collaborating, what we have learned yesterday, what we are doing today, and what we are going to done tomorrow. That's another important point. Adding to extra vaginal surgeries offer great advantage of less morbidity, reduced operative time, keeping abdomen intact, and less hospital supply. That's more important. And reducing the heavy physical as well as economical financial burden. So this is the pro thing for the vaginal surgery, and I'm sure that all of you have thought of joining the online vaginal surgery course. Believe into it that we all want to do the vaginal surgeries, from basic episiotomy to giant fibroid can be removed through this route as a state of art. I'm sorry. Second important point, once understand the anatomy of the pelvis, we'll find out the tips and tricks of the major surgeries and will make it curious to perform it by your own. Since few eras back, apart from the episiotomy, Bartholin cyst excision, cervical cerclage, there was an era of laparoscopy before the gynecologists were comfortable with abdominal surgeries. But today is the era of vaginal surgery, and we can learn and we can do it. Being ignorant is not a shame as being a willing to learn. That's an important point. And this is a course with a 2-division course. There is a old slide, but I'm telling you all about hysterectomies, most of it. And it's a 2 non-hysterectomy sessions also will have. What is the applied anatomy of female genital tract, how the gynecological examination should be done, what are the lesions of the genital tract, what are the history of vaginal surgeries, all will come to know. Interrogation, contraindication, assessment, what is the vesicouterine pouch, how the rectouterine pouches, how is the perineum, how the vaginal hysterectomy for genital prolapse, anterior and posterior reconstruction without blisters, and all these points are there. But in a nulliparous patient, how can we do? How the big fibroid, what we have to do? How to do the uterine debulking? How the hysterectomy with the previous abdominal surgeries are important. How to take a trial of vaginal hysterectomy in a trial of vaginal route, when to do the trial and when not to do the trial. What are the contraindications of abdominal route are also important about it. Then oophorectomy at the time of hysterectomy, then the concomitant helping oophorectomy, which we can do, adnexal pathology and vaginal hysterectomy. So these are the several points how we can do the subtotal vaginal hysterectomy also. And the difficult vaginal hysterectomy, what are the difficult one with a previous section, with a large uterus, with previous surgeries or previous any problems or anything like that. And the hybrid approach of the difficult vaginal is sometimes we have to remove it and the put a scope, or sometimes we have to run and do it in a hybrid approach. And the hysterectomy in the high-risk women, for example, she's obese, she's having hypertension, she's having so many things, and all the vaginal hysterectomies, these are the important point. We'll simplify the technique of the hysterectomy. One-day hysterectomy, which I do in a lot, I have more than done 10,000. I discharge the patient on the same day, on 24 hours. So how it has done, we'll talk about it also. Then malignancy and a vaginal hysterectomy is another important point. The vaginal hysterectomy, the carcinoma of endometrium, all the postmenopausal women, what the decision we should take, we should do it or not to do it, what are the pre-counseling things are important. Then there is an associated central incompetence, or there is a non-gynecological surgeries. What is the place of the sacropinous colpopexy and the hysterectomy and sexuality. This is a very important topic, but because the patient becomes menopausal and they want so many things. So examination under anesthesia, that's all important. Then the use of ligature sutures, how to do the subtotal one also. And if there is already a subtotal hysterectomy, how we can reduce the remove the stump of the this thing through vagina. What are the evolution of the injuries? How to do the position of the patient? How the surgeon's comfort to increase the visibility of the deep inside vagina? What is the modification of the instruments? What are the complications of the mortality, morbidity? So all those things are there. So vaginal course varying from the certificate course to the fellowship. It's not a fellowship program. I'm just a course. It's not written over there. But if somebody wants to come and do the on-site course, they can also join. We train them and doing the performing in a best technical skills are there. So go beyond this. We have to plan, schedule, read always confusing. Whatever I'll try to provide the each time, whatever the recording will be there to each and everyone. So you'll have the recording all the time, either on the YouTube or the direct, and that will be there and learn and do the things. If you have chosen to do the course, please learn it, read it, go and repeatedly read it so that you can do. Also able to tell you about episiotomy, cyst, genitoplasty, vaginoplasty, we can talk about, but this course is vaginal hysterectomy course. So vaginal surgeries are there. Perineoplasty, sacrospinous fixation is there. And Fothergill is also there. We can do cerclage, ectopic, myomectomies, ovarian tumor, tube time. There's a one session over there, which we can talk about. PVF repair and RVF repair, though we are not going into detail of it, but still they are there, which one should know. Other surgeries which we can do, vaginal lease, labia majora, excision, reduction, liposuction. There are so many now. You have seen all the aesthetic gynecology is coming up with all those things, but we are doing with the surgical techniques. We are not using a laser or anything. So these are the newer perspectives. And what are the points which we should talk? The surgical plexus, obliterate, posterior cultivation. There's several things. So you have so many things to learn. And who can attend? I always talk about all the practicing OBGYN, PG, MD medicine. They've written the course of OBGYN in 3 years, surgery and DNB. So understand the pelvic anatomy. Instruments are, these are the attractions. We need patience, promptness, perseverance, passion, perfection and proficiency, and presence of mind. And we should know about the medical legal aspect, because all the government is coming with the hysterectomy to be done or not to be done. And we should go for this type of courses because we can understand the anatomy, we can learn the basics, and that's all. Thank you so much for the patient listening. And I think this orientation program will help you out, that we please try to join sharp in time, and we'll finish it in a sharp in a time, so that it's almost 60 to 90 minutes program. And whatever you want, you just put it in a chat box so we can talk about it and we can discuss it about it. Is it okay? Thank you.